Coming up, meet our first-rate healthcare experts right in your own community, where we can take a closer look at the healthcare needs and treatment options. We also bring you some easy solutions to preventative care. Plus, you'll also be coming over to my house, where we'll be cooking up some of my favorite recipes to show you how simple, tasty, and satisfying healthy cooking can be. Our shows are about education, so you can make healthy choices for a healthy lifestyle. So join us as we keep our community connected to good health. Come on in and let's get started. Hello, my name is Dr. Joe Clemente, and today we're at Medical Health Center in Middletown, a division of Monmouth Health Group. We have multi-specialty group here, pediatricians, cardiologists, internal medicine, family practitioners, orthopedic physician, all under one roof. We do most of our diagnostic testing here, where you can have blood work, your cardiac tests, chest x-rays done under the same roof. By doing this, we felt that it will be easy access for patients for their care, and then we can continue with their follow-up care, whatever they may need. Recently, we partnered with Barrows Health Group, and this has helped us expand our services not only locally to our community, but also statewide. Barrows Health Group has given us the possibility of now incorporating multiple offices. We have offices in Tinton Falls, Red Bank, Middletown, and Hazlitt. The testing can be done here or at our other facilities, and at the same time, any of our patients can go to any of the offices we have. The charts or electronic medical records will be all integrated, and your information will be easily disseminated. By developing a medical profile with us here, we may be able to develop a program for you where we may prevent issues before they arise. Therefore, changing the face of medicine more into a preventative care as opposed to treating you after the problem has occurred. Here at our center, we do have a weight reduction program that you'll be treated by a physician, and we have different methods, whether we use a Weight Watchers method, whether you need medications, whether you need some powdered drinks. But we take obesity seriously, and we know if we can help you reduce your weight, you will then in the future have many less medical issues. Hello, today we're here with Dr. Mike Barrows, one of our pediatric endocrinologists, part of many of the subspecialists that we have here in our pediatric department at Monmouth. So tell us, what does a pediatric endocrinologist do?
We actually treat all endocrine disorders, hormonal disorders, a lot of short stature, precocious puberty, type 1 and type 2 diabetes, thyroid abnormalities, so everything hormonal, dealing with the endocrine glands. We
have glands in the body that produce hormones,
yes,
and then these hormones help with growth and sexual changes.
And there's either deficiencies, underproduction, or overproduction of these glands, and that's what we treat.
So one of the big things I think you treat is diabetes, and particularly type 1 diabetes.
Predominantly type 1 diabetes we treat, which is more of an autoimmune condition where there's destruction of the beta cells in the pancreas. Traditionally, I guess these are considered insulin-dependent patients.
So the insulin pumps, I guess it's a lot easier with the kids.
The insulin pumps, help out with their glycemic control. It also gives them the flexibility in terms of bolusing throughout the day rather than having multiple injections throughout the day. And their control and hemoglobin A1Cs are oftentimes improved on these insulin pumps.
I'm sure frequently parents come in to see you and they say, is my child's growth too slow, or should they be taller?
There's some children that come in with histories of familial short stature. There's some that come in with constitutional delay, like those are kind of your late bloomers that may have their pubertal growth spurts at a later age. But then there are children that have other endocrine disorders that we see, like growth hormone deficiency, hypothyroidism, and rarely Cushing syndrome. They're lacking a hormone called growth hormone, which is secreted from their pituitary glands. So we treat them with recombinant growth hormone, which is an injection, a daily injection, that we hope to normalize their growth hormone levels, and these levels called IGF-1 levels, which are mediators of growth hormone activity, and hope to get them to attain, their genetic height potentials too, or their mid-parental target heights.
And do you get good results with that?
Yeah, for the most part we do. If they're deficient, yes, and if we identify them and treat them at a young enough age too.
And frequently, even in my family, sometimes as children are growing and they get, I guess, what we call some breast buds or little nodules, and whether it's the boys or the girls, and then the parents think that there's something going wrong. Tell us about that and alleviate their worries.
I mean, for the boys, it's relatively common in adolescents to have gynecomastia, which is some breast tissue. It will resolve over time. Prepubertal gynecomastia, though, in males is more of a concerning feature. In females, oftentimes, resolves as they get older and doesn't factor into their true timing of puberty in later years. But these girls also need to be identified and evaluated, because sometimes they can go on to develop true precocious puberty too. The pediatricians are good at identifying it and seeing us initially, because we like to evaluate from the beginning, and then to say if they need further evaluation, or if it's resolved over a period of time, then to refer them back to the doctor and say everything's okay.
One problem that I think is more common than people think is ambiguous genitalia, which a child is born and you're not 100% sure if the genitalia is female or male. Mm-hmm. And then they sometimes rush to surgery. Mm-hmm. How do you deal with a problem like that?
There's a wide spectrum of different conditions that can cause ambiguous genitalia. So every case is unique, but it always needs a multidisciplinary approach, and you need to explain the condition and the outcomes to the parents very carefully, because it's a complex, can be complex conditions.
I'm always like, let's not rush to. I've heard some right when they're born they try to do surgery, and I always felt it was just better waiting a little.
Yeah, most surgeries aren't done right away. Depending on the condition, if some are done. If it's warranted, it's usually a little bit later.
So let's change gears for a second, and this got to be a big question for you. What should my child's weight be? Are they overweight? Are they underweight? Are they obese?
We measure it based on body mass index, which is weight for height. And look, in pediatrics, it is age and gender. There's charts for it. Above the 85th percentile is considered overweight, and above the 95th percentile is considered obese. So we like to look at that growth chart.
We have a problem, and we have a national crisis on our hands with childhood obesity. Just some of the statistics I was looking at. 1/3 of our children are obese. 1/3 are going to develop diabetes, right? This is the first time that the life expectancy for children born from the 2000 and up may be less than their parents. And one alarming statistic that I saw was between the ages of 2 and 19, they consume per year 7 trillion calories due to sweetened drinks. 7 trillion, that's with a T. So where do we go with this obesity crisis, and how do you direct parents on what to do?
Yeah, well, like you said, the statistics, the rates have tripled since 1980. In terms of pediatric obesity. Actually, some of the highest rates are in the age 2 to 5 category. Even in the state of New Jersey, it's 17% of children aged 2 to 5 are obese, and about 10 to 15% in the adolescent age group. Once we identify it that their BMI is above the 95th percentile, and there's no other endocrine abnormality. If there's endocrine, we treat it. If there's not, then we get them involved with a personal trainer, usually for routine, regular exercise, and with a registered dietitian in terms of balancing out their diet and having appropriate amounts of carbohydrate, protein, and fat in their diet.
But if it doesn't come, these young kids, 2 to 5, it has to come, I believe, from the family.
So, for the most part, we have to educate them about the morbidities associated with obesity, like hypertension, dyslipidemia, sleep apnea, orthopedic problems, fatty liver. So we educate them with that. We also explain to them that as children they have a higher risk as adults to remain obese and have the comorbidities associated with adult obesity. And,
which end up coming to my lap.
Yes, yes.
I mean, heart disease,
cardiovascular, cancer,
strokes, cancer,
orthopedic problems. So, you know, I think with good education and follow through with the parents in terms of getting them involved with exercise and on a nutritional plan, for the most part, the majority of patients do quite well. I always tell the families and the child that even if there's siblings in the house that do not have weight issues, it has to be a family approach, and the lifestyle that we're trying to get them to follow has to be from the whole family, you know, in terms of, you know, the exercise and the nutrition. You know, all the brothers and sisters and both parents need to be on board, right. Not just to say this one child in the family is overweight or obese and they're going to follow this plan, but everyone else is going to do something different, because then they feel alienated and they don't follow through. Gym isn't mandatory and it isn't daily all the time, and sometimes school lunches aren't the healthiest. So I think starting at the schools is very important in terms of you know, improving this the obesity epidemic.
We need to get our hands around this because, you know, the costs. I looked at a statistic in 1998. The cost of treating childhood obesity was $40 billion. Mm-hmm. In 2008, the cost of treating childhood obesity is $150 billion, and that's not to say what's going to happen later in life. Our
team here consists of, there's myself and two other physicians, Dr. Kirk Karinsky and Dr. Vladi Ostro. We have 4 dietitians. We have 3 CDEs, diabetes educators. We also have a child psychologist, who's very important, you know, with all our patients in terms of you know, helping, you know, children and families cope with, you know, diabetes, obesity, and other endocrine conditions. And we also work collaboratively with our, you know, pediatric pulmonologists and gastroenterologists for other, you know, with obesity, for, you know, for sleep apnea and fatty liver. So it's a team approach.
Well, I always was impressed at the amount of pediatric subspecialties we have here at Monmouth.
Yes.
And obviously we need them. Well, thank you for your time today.
Okay.
Today we're here with Lauren Dorman, who is our registered dietitian and is certified in diabetic teaching. Hello, Lauren.
Hello, how are you?
Obesity has become an epidemic in this country. And it's sad to say, but obesity soon may be one of the leading causes of preventable death in our country. What is a normal calorie intake for an average person?
A normal calorie intake for an average person would be about 1,800 a day. But it could range anywhere from 1,200 to 2,400 depending on activity level. However, if someone's on too low of a calorie level, they actually might prevent weight loss from occurring.
When I talk to people about proper nutrition, not necessarily food has to taste bad. Food can taste good, but the portions have grown. So let's look at some what normal portions are.
First off, we have a box of multigrain Cheerios here, okay? And most people don't look at what the most important thing on a food label would be, which is right up top, and it says serving size. So we want to make sure we focus on that. Most people are not even reading labels. So serving size for this is actually 1 cup. So right here we have 1 cup of Cheerios, and
which doesn't even fill up the bowl.
It doesn't. So we're looking at huge bowls that, you know, some of these kids and adults are consuming. Most people would consume 2 cups. So if you monitor your portions and you're having 1 cup, you'll be able to lose weight. This is the Quaker oatmeal. You might say, oh, nice, heart healthy, you know. But if you supersize it and you make it into a huge bowl of oatmeal, you're going to prevent weight loss. So this is the serving right here, which is a 1/2 cup, which is uncooked.
And that is a normal portion?
A normal portion.
I see you have a big gulp glass there. So
the double gulp?
I mean,
you're looking at
776
calories, which is actually 64 teaspoons of sugar
in one of
that
those
you're pouring
big
into your body. Yes.
So imagine if you need 1,800 calories a day, and you just took in 800 calories from the drink, I mean, you're already going to be there with 1 meal.
Exactly. So I really, really stress to people they must consume liquids that are calorie-free in order to promote a healthy weight.
How did it get to, you know, eating more and larger portions is good for you. How do we get there?
We got portion distorted. The restaurants and fast food places, all of it is huge portions. And our kids are growing up thinking that, you know, pasta portion is supposed to be 3 cups of pasta. Cereal is supposed to be 3 cups. If a person can eat the same thing that they've been eating all along and just eat a smaller amount of it, they will do wonderful. There was once a couple I worked with that just ate off of a dessert plate instead of eating off of a large plate, and they lost 100 pounds that year. It really comes down to simple, you could still eat the same food you like, but smaller portions. So if anybody with any issues nutritionally, whether it be diabetes related or just for weight gain, for weight loss, if they would like to make an appointment with me, they can come to the center. The phone number is 732-923-5025. That's Monmouth Medical Center for Diabetes Education. And we're here for the community, for their needs. We're here to help all patients with nutrition or diabetes related issues.
If a child comes in with their parent and they're not sure if their arm broke when they fell, we would examine the child, and we could even get an x-ray done while the patient and the parent wait to find out if they need to be referred to an orthopedic specialist. Any concern should not be ignored. Here at the Medical Health Center, we welcome you to just walk in at any time. For our adult population, I would recommend that you see your practitioner at least every 6 months to get blood work, perhaps an EKG, maybe a chest x-ray. No reason to wait. Come on into our office. You can be seen, have all your diagnostic testing done, and be seen by a specialist if needed. And you should at least have a baseline EKG, a chest x-ray, and blood work, all routine blood work. Those are the basics that everyone should have as an adult. And also don't forget your flu shot in the fall. You have to take charge of your own life and make these decisions. It's easy enough to just walk in and have all these testing done, and then at least you have peace of mind.
We work hard before and after practice, catch at least 100 balls before practice, and after practice I go home and do about 100 push-ups. And it's not about what you do on the field, it's what you do off the field that makes you successful. I love living healthy. I take different vitamins and shakes to help support my body so I can perform to my fullest potential out on the football field and track as well.
Before you run and then after you run, there's certain things you can't eat and certain things you can. And it benefited me because I became a state champion in the 4x4 relay.
Yeah, soda, I haven't drank soda since my sophomore year because our coach told us soda is bad for you. And ever since I started drinking soda, I've seen a lot of benefits in my skin and in my performance on the track and football field.
And he's just a big help, so he makes everybody healthy and makes sure that if you're not healthy, you make sure that you don't go in so you don't hurt yourself even more.
So I take protein shakes after football practice and after I work out.
I can't eat McDonald's in the season. I don't drink soda either.
I just do sports through all 3 seasons just to keep me focused. I think it pumps up my work ethic as far as in the classroom. As soon as I get back from practice, I'm tired. I just get some food in me, and then I'm just right to the books.
We have to stretch a lot. Coach George is big about stretching.
We got a lot of stretching in, and just a strong warm-up, and that's how we really prevent injuries. The relationships I've made, I'm going to have for a long time to come.
Well, you basically make a brotherhood, and I think that you can have these guys forever, and it's a big deal for us.
On a football team where everyone has to work together to achieve their goal, it really teaches you to work with other people no matter what happens in life. So whether it's in the future with a job or in the future with your family, you have to cooperate with the people around you to get things done.
Good technique helps tremendously with not getting injuries, especially head injuries. Really, the most important part of the game is not necessarily strength, but speed. The bulking doesn't necessarily make you a better football player. The skills, the agilities, those things make you a better football player. We think about how important nutrition is well before the game ever comes around. I think it's critical that young people understand, especially from coaches, steroids and creatine and different things to get them stronger. That is only going to slow you down and not get you to point of contact fast enough anyway, and maybe get you really sick when you don't want to be sick.
Every day we do water. Every game day we do either a Gatorade or a Powerade or Pedialyte. So hydration is really the key. If someone has chronic issues with cramping, then we will sit and discuss their diet, see maybe what they're lacking or what they're getting too much of, if it's junk, and we'll try to adjust their diet that way to help them increase their performance on the field and decrease injuries. There's been a rise of concussions just because of the awareness in the community now of concussions. A ding is really a concussion. You know, you always say you can't unring the bell. So if somebody gets their bell rung, it's a concussion. It's not just sit out a couple plays and you go back.
Becoming a better football player is a process. It's in the classroom, it is in the weight room, it is speed and conditioning workouts, and it's skill workout. And the faster you are, the better you move your body through those drills and through those plays and executing those assignments is what's going to make you a better football player.
Many people think it's hard to cook. It's not hard to cook, even though I take a lot of my mother's recipes that I remember, but I add my own stuff to it, and she even gives me a compliment once in a while. Once you decide on whether you want to eat a fish or a meat or a pasta or vegetables or salads, you know, say what kind of textures. So I like to add some nuts to my salads. I like to add some berries to my salads. And little by little, it's trial and error. It's not hard, and it's quite a lot healthier than going out to eat. Today we're going to make a dish that I've learned from my mother actually, and it's a zucchini pasta dish. And the reason I started making it is I have a garden back here, and you can't imagine how much stuff can grow out of a small garden. Now the first thing I'll do is I'm going to saute some onions. And I like to cut them very thin, because as you cut them thin, it just takes a shorter time to cook. I'm going to add just some olive oil to the pan. I've also have some garlic that I've sliced up earlier. A little bit of the garlic, just for flavor. Start sauteing that, and then I'm going to add my onions. I always have some Italian seasoning, parsley, and a combination of red pepper, salt that I have around all the time as a mixture. So I'll take a little bit of Italian seasoning, just a little. I love to add parsley, so I'll take 2 pinches of parsley. Pepper, salt, mixture. Now the zucchini, on the green ones, I will take off a good amount of the skin, but I'll leave a little bit on just for color. You slice it in half and in half, and you quarter them. But when I learned this from my mother, she used a kind of different kind of squash. If you don't see them much around here, they almost look like an elephant nose. And we call them guguts. And now I'm going to add the zucchini. And the sauce, you just really want a liquidy sauce. Any kind of tomato, a can of tomatoes, you place it there, put the seasoning that you like. Salt, pepper, a little olive oil, a little red wine, a bay leaf, and just let it cook down. That we're going to use at the end of the dish. Once the zucchini is in, this takes about 10 minutes. Again, my pepper and salt mixture, parsley. I'd like this to be more of a loose type sauce. So we'll just coat the bottom with some chicken stock and let that cook down. My wife likes this white wine, so we use this white wine just to give it a little bit of flavor. It's time to add the sauce. So as I say, this was a very simple sauce that's just been cooking for about simmering for a half hour, and I'm just going to add it to our mixture. Actually, what makes this dish is the Pecorino Romano cheese, and I learned this from my mother. Once you have it into the cubes, you're going to add it to the zucchini mixture only for about 1 minute, because you want the outside to remain a little soft, but the inside to remain hard. It's almost like a treat every time you find one in the pasta. So I will just add that in, and more or less I'm going to let it cook for about a minute, and turn the flame off. Once the pasta is cooked, we'll pour it over and we'll see how it came out. If you cook with fresh vegetables and fresh ingredients, it's always going to taste better. At the end, it's about the taste. This is a pasta dish, and people will say, oh, a pasta dish, you can get fat on that. It all depends on the amount you eat. We have to learn portion control. And our kids, they're not burning that many calories. And unfortunately, as childhood obesity and adult obesity progress, incidence of coronary disease, diabetes, arthritis, hypertension are only going to get worse. And it's time to add the rest of the sauce we've made with those nice chunks of cheese. So let's just see if we can more or less think of what a handful is. Get some of the zucchinis in there. And obviously, I always pick out the chunks of cheese for myself. You may add a salad to it, you may add other types of food, but more than a handful, you're already going to start going above calories, unless you're some great athlete, which then you'll need to burn those calories. But most of us are not. Portion control, you can eat well, you can make great dishes. Bon appetit. So Gus, do you want to taste? It's time to taste. Sit down. Remember, he's an Italian dog. Oh, good one. Good. You need a high five? Yeah. That's really good. We hope that you've been inspired to get up and get moving, and most importantly, to take greater preventative care of your life. Remember, choices take only a moment to make, but can last a lifetime. So make sure yours are healthy ones for you and your loved ones. By educating you in preventative care, we would like to stop the illness before it starts. We will always be accessible, whether it's in Hazlitt, Middletown, Red Bank, Tinton Falls, or any of our other offices. Whether you come to our walk-ins, whether you have a question, whether you need to have some specialists, please contact us. We're there for you. We'd like to welcome Dr. Ricca to our new Hazlitt office. Thank you for joining us. I'm Dr. Joe Clemente, keeping the community connected to good health. See you next time. Since this is an educational show, if you have any questions or would like to see particular topics, please contact us and maybe we'll use your suggestions. Write to us or use our email address and let us know.